you heard me tell this story to Sean Baker of the doctor that called me and yelled at me for fixing her patient's fatty liver. Like that was insane, and that's just one example.
Can you share that example? That again, I try not to be surprised by this stuff, but I'm always surprised by this level of pushback. This is crazy. Can you tell us that story?
Yeah. So, you know, I I'm out in Hawaii, right? And so I would say a third of my patients are Filipino or some Filipino mix. And what I've observed, I'm not saying this is an actual medical fact, is that they have a very high degree of fatty liver disease. It's probably a combination of all the tropical fruit tend to eat with desserts and rice and all these other things. And so I have a lot of people come to me to reverse fatty liver, which, as you know, Casey, with keto and carnivore, you can so easily fix that. I swear in 3 to 6 months. It's like piece of cake, right? Well, I did this in a patient and I got a phone call from her PCP who yelled at me like, I had to kind of do this on the phone. How dare you reverse my patient's fatty liver? If I find out you're seeing any of my other patients, I'm going to file a complaint against you. So when her volume started to come down, I said, you know, what I want to know is what you're really mad about, because I did what we are supposed to be doing as doctors. And she said, my patient doesn't need me anymore, which, come on, that's such a fear-based mentality that comes from a place of lack. There are so many people that need healthcare. I can't name a single doctor out there, unless you're terrible at what you do for a living, that is not getting an influx of new patients. So why then this mindset of we have to keep them sick so they keep coming back is my question.
That's crazy. That is mind blowing. No,
Yeah.
so how does it feel now with your current practice? We're going to get into your personal story and everything, but how does it feel now in your current practice when somebody says, "Hey, thank you for everything. I really appreciated it. I don't need you anymore. I'm good. See you later."
My goal is to educate and empower my patients, get them to a place of optimal health, and then cut the umbilical cord. And I tell them this up front because I always take new patients. In the month of August, I got something like 65 new patients on top of the ones that I was already seeing. And I am not one to create codependence or anything like that. Ask my children, they know this. Like, it's about education and empowerment. And that's how medicine should be practiced. So I want them to leave at some point, sooner the better. That means you caught on and you did it faster, right?
Yep. I love that. Yeah, we love getting fired
Yeah.
around here for like a nutrition coaching client or somebody who needed us for personal training. We taught them some skills and they're like, cool, I'm going to go practice these on my own. It's like, great. That's awesome. There's always more people
Yeah.
to help, like you said. So I love that approach. And as I was
Yeah.
diving a little bit deeper into your story, as we mentioned in the introduction, you've been in healthcare for over 27 years. Like she
Mhm.
was a pharmacist for like 14 years. She did this and this other industry for so long. How old are you? You look like you're 30.
I make 52 in December.
No way.
Thank you.
Wow.
It's the
Like,
keto.
yeah, apparently, or either that or you graduated at the age 2 or 3 and started practicing. Like, that's
No,
incredible.
no, no, no.
Wow.
I appreciate that.
Well, okay, so
Yeah.
so I remember probably, I don't know, 10 years ago, I started training a guy. He was a pharmacist. And so that was the first kind of I guess like learning I'd ever had about what the job was like. And we just did some training. It was way before I found low carbohydrate stuff. I could not believe what this guy's career was like. It was so many hours, so much work, so much BS that he had to put up with on so many levels. It was
Yeah.
nuts. I'd always have to be rescheduling workouts for him because if he called in, he was working like easy 60 hours a week. It's every pharmacy job like that.
Well, okay. So there's retail pharmacy, which is like your CVS, your Walgreens, where they're counting pills by fives and they're filling prescriptions, right? So just think of the sheer number of prescriptions the average person is on. That'll kind of give you an idea of how stressful and busy it is. Meanwhile, the phone is constantly ringing. People are up at the counter saying, hey, can I talk to the pharmacist? I have a stuffed nose. What do I take for that? And you're getting all these phone calls from doctors' offices all day long. Okay, so it's very stressful. Then there's hospital pharmacy. where you're dealing with the patients that are staying in hospitals. You're calculating all these doses of these dangerous medications for them. You're rounding in on the floors with the doctors. Like, it's two very different jobs, and I've done both. Um, the job in the CVS and the Walgreens sucks. You have to be a very unique and special unicorn of an individual, in my opinion, to do that for a living, because not only are you standing all day, we have become a society where, and I'm going to tell you this as a doctor, it takes zero effort and energy to write a prescription. And I think the problem has become laziness, right? Why? This is what patients say. How come every time I go to the doctor, I'm given another prescription? Because that's the easiest way to get you in and out of the office in 5 minutes or less, right? The more patients we see, the more money we make, because the more we can bill the insurance companies. To actually teach a patient how to eat, sleep, relax, exercise takes time. Nobody wants to do that. So the retail pharmacists are just inundated. You know, it's mind-blowing. And I did it for a number of years. And then I was like, I can't do this anymore. This sucks. You know, I was really sad. Like, what am I going to do? I don't think I can do this.
Wow, that's crazy.
Mhm.
We just recently did a whole episode about this, and I want to get your opinion. I don't think we talk about side effects of medications enough. As a
Mm.
pharmacist, what do you see? Like, you have to kind of juggle not only a primary medication, but also medications that deal with potential side effects and how those affect other things. How are you able to stay on top of any of that? And do you think that people are talking about side effects as much as they need to be?
No. Wow. I love that you brought this up. No one ever talks about this. Okay, so within the electronic system that is used in each pharmacy, all of the side effect information is built in. Okay, so electronically, the system is supposed to be flagging for drug interactions and all these things. Okay, but no system is perfect. And it doesn't take into account individuality. Because, Casey, you might take a Z-Pack for your cold and flu and be fine. You are an average white male. Then I take the same Z-Pack for my cold and flu, and I have a host of side effects. Why? Because I am an Asian female. And if you look at how clinical trials are designed, it is usually 90% white men and women. But the world is very diverse. And that's my beef with clinical trials. It tells me nothing about how any of these medications are going to react in a diverse culture and population like we have here in the state of Hawaii or the state of California, right? And so pharmacists in pharmacy school, in the first year and a half, we follow the exact same track as MDs, where you're learning all of the anatomy, the physiology, all of the different disease states that exist. But in the last 2.5 years of our schooling, it is all medication focused, where we are learning exactly how medications work, how they interact, what patterns and trends you can look for, all the different side effects. The pharmacist board exam, to pass it, is extremely difficult. Now, having said this, pharmacists are the experts in medications. Why are MDs doing the prescribing?
That was my next question that drives me nuts.